This is the story of the first person I ever knew with lymphedema, my high school English teacher, Jackie Miller. We left off in part 1 with the first signs of ankle swelling in 1982. The immediate concern was cancer, but after testing, the only conclusions were an ovarian cyst that might be putting pressure on a vein, or she had scar tissue from a biopsy causing swelling.
My best recollection as to what they surmised to be the situation causing it was scar tissue.
There was no cancer and no blood clot in a deep vein. What else might contribute to her swelling? In 1979, Jackie had a form of Hodgkin's lymphoma called nodular sclerosing, which develops in the lymph nodes. Sclerosing describes the appearance of the lymph nodes which contain a large amount of scarred or fibrotic tissue. Scarring in lymph nodes would impact their ability to function properly, and I suspect that was the primary cause of her lymphedema. By 1984, Jackie had other sources that could contribute to her leg swelling. Source number 1, surgery. Jackie had exploratory surgery after initial leg swelling, as well as a tubal ligation in 1980, and a biopsy. Any incision could disrupt lymphatic capillaries, but capillaries can regenerate, and they can find alternative routes for draining fluid. Incisions can also cause scarring, which could impact lymphatic flow, but these incisions were small, so surgery may or may not have contributed to her leg swelling. Source number 2, venous disease. In 1984, reference suggests Jackie had venous insufficiency in her leg. In venous insufficiency, the valves are damaged, causing blood to go backwards, pooling in the legs and increasing tissue pressure, which results in edema. In these cases, the lymphatic system begins to work overtime, trying to keep the involved area, the leg in this case, from swelling. But after a while, the lymphatic system fatigues. The fluid that would normally enter the capillary stays in the tissue, leading to inflammation and scarring, damaging the lymphatic system in the leg. Here's an example of someone who had venous insufficiency involving the saphenous vein, the longest vein in the body. Like Jackie, she was a teacher who stood on her feet during the day or spent time sitting at a desk. In these positions, there is little to no muscle use in the legs. Not moving for long periods, especially in a standing position, increases blood pressure in the legs. This high blood pressure can damage the veins over time, leading to venous disease and eventually to lymphedema. Jackie had one more source for swelling. Source number 3, local infection. Jackie had a cellulitis infection in her leg. Cellulitis is a bacterial skin infection that invades an area of the body, often the leg. Your lymphatic system responds by causing its muscle-pumping units, the lymphangions, to spasm, preventing the invading bacteria from spreading. As a result, the lymphatic load remains in the tissue, causing scarring. And just like in venous insufficiency, the scarring damages the lymphatic system, leading to lymphedema in this area. In the 80s, doctors prescribed a diuretic elevation and compression hose. Not necessarily the recommended kind of compression for lymphedema, but it was compression nonetheless. And although a diuretic is still prescribed today, in cases of pure lymphedema, when that's the sole condition being treated, diuretics are not an appropriate treatment. In the second edition of Foley's textbook of lymphology, it states, diuretics are inconsistent with the causes of lymphedema and also inconsistent with the pharmacology of these drugs. Furthermore, there are potential serious side effects. By 1987, Jackie's swelling had progressed. Her leg became more firm and swelling extended from her foot to her groin. It wasn't until the 90s that doctors appeared to recognize or diagnose lymphedema. Now, between 1983 and 87, lymphedema becomes a more prominent feature in Jackie's life, but it wasn't the only feature to make a debut. In 83, she had a bad case of shingles and a pelvic infection which became septic. In other words, it became life-threatening. She also developed a cellulitis infection in her leg. In 1984, Jackie went to the hospital again, this time with shortness of breath and chest pain. She was found to have excess fluid accumulating around her lung and heart. These conditions are called a pleural effusion and a cardiac tamponade. As if that weren't enough, she also had a collapsed lung. Her situation was, again, life-threatening and required surgery. Surgeons cut open the side of her trunk, a thoracotomy, to get to her lungs and heart, and they drained the excess fluid. In 84, that was a really big year for her. I was surprised at all the things that she went through. She was having some symptoms probably of shortness of breath.
Very much
was she
so.
having a fast heart rate, or?
Shortness of breath was the main thing. She had 2 hoses that ran through her rib cage into the sac around the heart. They drained into 2-gallon jugs on the floor.
One of the possible causes of this excess fluid is cancer, and in fact, a mass was found in her chest. A biopsy taken at the time of surgery revealed lymphoblastic lymphoma. Jackie's second battle with cancer. She started 6 months of chemotherapy and had preventative radiation to her brain and spine. With remarkable perseverance, Jackie got past these events. She continued to teach, to be a wife, and a mother. In Part 3, we'll look at what Jackie did to manage her lymphedema and how she faced yet another encounter with cancer, this time breast cancer.